अस्सलाम वालेकुम। कैसे हैं आप लोग? उम्मीद है ठीक होंगे। आई एम डॉक्टर मोहम्मद अली रबानी, assistant professor anatomy. Inshallah, I will be your guide today for the topic for the third of the three lectures on the topic of the gross anatomy of neck. The topics we are going to discuss today are the arteries of the neck, the arterial branching, the whole tree, the veins of the neck, and the lymphatics. This will be our highlight, inshallah, and we will discuss a pair of visceral organs, thyroid gland, and the parathyroid gland. Let's start with the arteries of the neck. Arteries of the neck include the whole tree. Let let me show you. Okay, the arteries of the neck, it includes the arteries in the artery system. We will read about the vessel. The major artery that is going to be in the neck is this one, the one that is going right here, that is the common carotid artery. As we move up, it will break up into two parts. The one that supplies most of the branches to the neck and the head regions, that is the external carotid artery, and the one that goes all the way to the skull, that will be the internal carotid artery. These are the major arteries of the neck, the one that you are able to palpate, the pulse that you feel here, that is the internal and common carotid arteries. One more artery that we do study in the neck a little is subclavian artery. A small part is shown right here, subclavian artery. This is the one which comes out of the thoracic inlet and goes to the upper limb. So from this point onwards, from the left one is larger than the right one is relatively smaller in length, but this is the artery because it has a lot of branches. The three parts, the part that is medial, this is the scalenus anterior muscle, this one. So the part that is medial to the scalenus anterior, it is called the first part. The part that is behind the scalenus anterior is the second part, and the part that is on the lateral aspect up to the first rib, that is the third part. So these are the arteries we are going to discuss in our discussion today. Please feel free to mention any questions that you might have, and if you're live, I will try to address as soon as I can. Otherwise, you can leave them in the comments and we can discuss in the comment section. Okay, let's discuss the common carotid artery. Let me move back to the 3D model, then I will summarize right here. If we look at the common carotid artery, I'm showing on the right side, left side. On the left side, it is an independent branch of the arch of the aorta. Let's add the things to our picture. And let's add also brachiocephalic trunk. And let us also add right common carotid. I'm using, by the way, 3D for medical anatomy. And right subclavian artery. Okay, then let's look at these things as we will be able to see. If we look at from the right side first, we will see here. Here you can see the arch of aorta. If you look inside, this structure will be the arch of aorta. On the right side, there is a common artery that is known as brachiocephalic trunk. And if you look in the anatomical position, just behind the joint between the sternum and the clavicle, sternoclavicular joint, just behind that point, it divides into two. It divides into the subclavian trunk that is going to the above the upper limb, above the first rib to the upper limb, and this is the common carotid artery. So this is the origin of the common carotid arteries on the right side, origin and termination. The things that you have to remember, it is arising from brachiocephalic trunk, and it is dividing and it is ending. There are two points at which it can bifurcate, at which it can bifurcate. It is not exactly easy to pinpoint one point. You sometimes it is written at the hide cartilage, hide bone, and sometimes it is written at the upper end of the thyroid cartilage. Both of these are correct because there is a variation between the two. You just have to remember the root values, the vertebral column values, the vertebral values, like it is at the level of C3 and it is at the level of C4. So when you're talking, you should at least match your discussion with the vertebral level. So if you say that common carotid artery divides at the level of thyroid cartilage, at the upper level of the thyroid cartilage, you have to mention that it is at the level of fourth thoracic vertebra, fourth cervical vertebra. But if you mention that it is dividing at the level of the hide bone, you have to mention the C3. Both of these are correct because here is a natural variation, but you have to just keep in mind that whatever you are speaking, you just maintain a consistency between the two. On the left side, you can see, let us hide these for now. Okay, the arch of aorta, it has a separate, on the left side there is a separate origin of left subclavian artery and the common carotid artery. They both move upwards above the neck. They are on the left side of the trachea, and as they come up, okay, let me hide it back again. As they come up and they separate from one another, they diverge from one another, and if you look at the anatomical position, you can see that they are again diverging at the same level behind the sternoclavicular joint. So they may not be coming from the same origin, but you will see them diverging from the same point. So this is about the origin, and the terminating part on the left side is also the same. It can be considered at the upper level of the thyroid cartilage. It can be considered, here it is shown in between the two. It can be considered upper level of thyroid cartilage and can be considered between the hide bone, but you should remember the levels of the two. So you should, description should match where you are describing the bifurcation. So this is common carotid artery, and okay, and this is how you actually define its surface anatomy also. Let me get the Mr. Surface. Okay. So if you have to mark the subclavian artery, sorry, the common carotid artery on the surface, what you do is you palpate these regions. You palpate the sternoclavicular joint and you draw a vertical line upwards. And there you find the upper level of the thyroid cartilage. And this is basically the root of the common carotid artery. It is behind this line. Let's try to find out how accurate I was. If we look at almost, you can see that the common carotid artery is behind this. And the interesting thing is that it has a pulsatile nature, so it can help you find out a little variation, that the deviation from the normal pathway. Okay, here the common carotid artery, it is dividing into the internal, external carotid artery and the internal carotid artery. But here is one interesting thing that you can see right here. Just near the origin of the common carotid artery, it is having a swollen structure. Here the wall is swollen like a balloon, and this is called carotid sinus. This is called carotid sinus. This is basically the baroreceptor. It Baroreceptor mean it senses the changes in pressure. So any raise in blood pressure or the fall in blood pressure, it is detected by this point, and it gives the signal to the autonomic nervous system to change the blood pressure accordingly. And this is supplied by the carotid branch of vagus nerve. There is the nerve that supplies it. So this is about the carotid sinus. And there is also another interesting structure that is known as carotid body. Let me get that into the model. Between the two bifurcation point, just in front of the sinus, here, this structure is known as carotid body. This is the structure that has a chemoreceptor function. It is a pair of arteries, glomus arteries, that are coming to it, and it continuously senses, takes sample from the it continuously takes sample from the blood for the oxygenation level. So this is what we talked about till now. The origin point behind sternoclavicular and the termination point at the level of thyroid cartilage, but I added to this, in addition to the thyroid cartilage, it may be, or hide bone can also be. This can be a correct answer also. In this particular picture, it is shown at the level of the thyroid cartilage. The carotid sinus, the vagus nerve is present between the two. The internal jugular vein is laterally. We will see the relations just shortly. The carotid sinus has a baroreceptor function. It is present here. It is supplied by the glossopharyngeal nerve, and the carotid body is just in front of it, right here. And it has a chemoreceptor function. It detects carbon dioxide. What are the relations? What are the structures that are related to it in a different views? Okay, what structure is behind it? Let me Okay, what structure is behind it? Behind it, in this particular picture, you can see the muscles that are present behind it. The muscles that are present behind are the scalenis group of muscles. So there is scalenis anterior at the upper end, and as we go on, this is the scalenis anterior. Behind that, there is also sympathetic trunk. Let me show you right here. Let's add sympathetic trunk here. Oh, sorry, left side. On the left side. Okay, so you can see the common carotid artery. It is posteriorly related to this muscle, the scalenis anterior. It is posteriorly related to the sympathetic trunk that is behind it, and behind it, through the scalenis, indirectly it is linked to the transverse processes of the cervical vertebra. Let me get the book also open. Give me 1 second. Okay, so we were talking about the relations here. So this is about the posterior relations. Moving on, the front, anterior relations, anterolateral relations. Basically, on the front, you can see that on the other aspect, it is originating from behind it is passing through the root of the neck. So all of the muscles that are in front of the root of the neck. So here the infrahyoid group of muscles, the sternocleidomastoid, all of these that will be in front of it will be visible right here. Okay. And there is a middle thyroid vein that is passing in front of it also. Medially, on the medial aspect, you can see that there is trachea and larynx and trachea. If we enteromedially, if we look at its trachea and larynx, just behind the trachea and larynx, obviously there will be pharynx and esophagus. So these are the structures that are related to it medially, and between these structures there is running of the recurrent laryngeal nerve. And on the medial aspect there is thyroid gland also. So this is about the common carotid artery. Apart from the two terminal branches, there are no other branches of the common carotid artery apart from this internal and external carotid artery. Let's talk about the external carotid artery. External carotid artery is a very busy artery in the neck. It is the one that is supplying most of the structures of the face and the neck and occiput region also. Let's talk about its origin and termination. First, origin, root, and termination. Then we'll go to the branches. Origin. Let me go back to the model again. So, okay. Let's follow here. So, it the origin part of the external carotid artery is the same point as the termination part of the internal common carotid artery. That is the bifurcation at the level of thyroid cartilage or hide bone. It then runs upwards towards the angle of the jaw, like here, just behind it, into the parotid gland in front of the ear, and it comes right here. It goes like this. From here, it goes up just behind the angle of the mandible, then on the lateral aspect of the ramus and the parotid gland, and here in front of the tragus, it divides right here. Let's follow it. Nerve, right? Let's follow this artery. Okay, this is the common carotid artery, as you can see highlighted. So it is originating at this point at the bifurcation. It is moving up. Just note the point that it is moving behind. It is not behind. It is moving deep to the muscles that are originating from styloid. This was the two muscles that are going to the hide bone, the digastric muscle and the styloid muscle. So it is passing deep to it. It passes through the thyroid gland, not shown in the picture here, and it moves up just below the condylar process, just below the head of the mandible. It divides into two main branches. You may see a lot of things, but if you are able to ignore and see the two things, this is the superficial temporal artery that will go and supply this temporal area of your scalp. And this is the maxillary artery. It's a whole new Pandora box. It is a 14 to 15 branches. We will go through them one again. So these are the two branches, and this is the terminal bifurcation of the common carotid, external carotid artery. So this is the external carotid artery, and this is how we demarcate its surface anatomy. We find the upper end of the origin point of the common carotid, origin point of the external carotid artery, as we saw in the surface anatomy. Let me go to the skin. Let's do it like this. So roughly, right here was the bifurcation point. Right here was the bifurcation point. We made the bifurcation point just like find the sternoclavicular joint and move up vertically till you reach the thyroid cartilage. Then you go to the behind the angle of the mandible. This is called the tragus of the ear, and just in front of the tragus of the ear. So this is where the external carotid artery runs. So this is where the external carotid artery runs. We can check it. We may be in the ballpark. So almost this is where the external carotid artery runs. So these are the points where you actually feel the pulsation just in front of your ear, just in front of your tragus. You feel the external carotid artery. So this is about the root of the external carotid artery. Then its branches. Let me get you to this slide and let me set up the 3D model. Just give me a second. So you may read the slide. Okay. Just 1 second. Okay. Branches. There are, interestingly enough, there are 8 branches. Some of the branches, about 3 branches, are emerging from the anterior aspect. 2 are from the posterior aspect. There are 2 terminal branches and 1 medial branches. I will go through them one by one. Let's talk about the branches that you have already read the name of. So the 2 branches that we already discussed are the ones that are forming the termination point. So this was the external carotid artery. This was the external carotid artery right here, and here it was dividing into the maxillary artery and the superficial temporal artery. So we are done with 2 branches, maxillary artery and superficial temporal artery. Here is the maxillary artery and here is the superficial temporal artery. These are the first 2 branches. It is easy to remember because these are the terminating points of the common external carotid artery. Let's discuss the 3 arteries that are originating from the anterior aspect. So if we are looking from this view, you can see right here, here and here. There are 3 branches that are coming from the anterior aspect. of the common carotid external carotid artery, and you can see they're diverging like this. One is going up, down, one is going up, and one is going almost horizontally. So the one that is going down, this one, this is ultimately going to the upper end of the thyroid gland below. So this is the superior thyroid artery. We'll get to their branches in short while. The one that is going almost horizontally, this is the lingual artery. It will go and it will supply the tongue area. And the one that is going roughly upwards, it is the facial artery. It will go up and into the face, and it will go all the way up to the medial aspect of your eye right here, and it will supply those. So we are done with 5 branches. Let me repeat. We talked about the 2 terminal branches, superficial, temporal, and maxillary. We talked about 3 branches that are moving from the anterior aspect: superior thyroid artery, lingual artery, and facial artery. There may be a common origin of facial artery and the lingual artery, and that is known as linguofacial artery or facial linguofacial artery, that is usually known as. So 5, we are left with 3 branches. Okay, so we have discussed the terminal, we have discussed the anterior, then the 2 posterior arteries. The 2 posterior arteries that are going to the back of the head. So here you are able to see them. The one that is the bigger one that goes all the way to the back, this one, I'm not able to click on it. This one, this is the occipital artery. This one is known as the occipital artery. So this goes all the way back. It passes through the sternocleidomastoid and goes all the way back to the occipital region of the skull. And then there is this one that is known as the post-auricular artery. Posterior auricular artery, by the name, as you can understand, that it is running on the posterior aspect of the ear, posterior auricular artery. Let me get back to the presentation. Here, let's follow them one by one. Okay, the 2 terminal branches. The first, the root from the bifurcation at the level of thyroid cartilage, move around the angle back in front of the tragus. Here it divided into maxillary, superficial, temporal. 2 branches, then 3 branches in the front. The one going down, that is the external, that is the superior thyroid. One going almost horizontally below the hyoglossus and the mylohyoid, below mine, deep to these muscles going to the tongue. One is going like there, below the angle of the jaw, and it will emerge from here. We will discuss it shortly. That is the facial. 5. Then the 2 that are going back, the one, the larger one, emerging from the lower aspect just behind the facial or lingual. This is the occipital artery. It moves back behind the sternocleidomastoid muscle. By behind, I mean deep to the sternocleidomastoid muscle and digastric, and it emerges from its origin point and it goes to the back of the skull. And there is this posterior auricular. It moves below and parallel to the stylohyoid and move just in front of the sternocleidomastoid and back of the ear to supply the region just behind the ear. And then we are left with one artery that is known as ascending pharyngeal artery. So ascending pharyngeal artery is a little difficult to see in the those pictures. Let me see. I think it is not shown here also. Let me try to get it here. Then I will show you the atlas also. Ascending pharyngeal artery is on the left side. You're not very easily seen in the atlas because it is totally on the medial aspect. So it is going and ascending pharynx. So it is basically hidden by the external carotid artery. You may see, if we look from here, you can see it going upwards and behind the external carotid artery. So it is originating from the medial aspect, and that is why we are not very much able to see it. So here you can see just the origin point, ascending pharyngeal artery, superior thyroid, lingual, facial, and here. There are a few relations that are very commonly asked. One of these is this relation. This one is very commonly asked in the examination. This relation, one a minute, and This relation is asked very commonly in the question. So what are these relations? So number one, talking about this one, the lingual artery, it's crossed laterally by hypoglossal nerve. It is very common in the MCQs in the past papers due to some reason. So it is an important landmark when doing maxillofacial surgery right here. So lingual artery, it's related to the hypoglossal nerve, and hypoglossal nerve is lateral to the lingual artery. And here we will go into the detail of the branches of the nerves in the cranial part section, inshallah. And here is the again relation of the hypoglossal nerve with the occipital artery. But in this particular case, hypoglossal nerve is deeper, hypoglossal nerve is medial to the artery, that is the occipital artery. And here one more question arises that it is a little troubling for you, or for most of us, at least it was for me. The occipital artery, it has two branches, both of them are supplying the sternocleidomastoid, the lower one and the upper one. These are both supplying the sternocleidomastoid. The MCQ that comes here is this. You can see the hypoglossal nerve coming right here, moving just around the external occipital artery, and winding around it to go front, and it winding around it to go front, and it is held in this place by this branch, inferior branch of sternocleidomastoid artery. So this is the point. And another MCQ comes, the superior branch of the occipital artery that supplies the sternocleidomastoid, it is running almost near the accessory nerve, sorry. So it is a indication of that nerve. This relation comes in handy. Okay, this is a little heavy picture. I don't want you to go through it all at once. Let me break it a little for you. I just want to discuss the branches of these branches. So first, let's talk about the external thyroid artery. External thyroid artery. So here, the external thyroid artery is originating from the common external carotid artery. So it has a few branches. There is a branch that goes into the larynx, that is called superior laryngeal artery. It pierces the thyroid membrane and goes down. There is also a branch not shown right here that runs just here parallel to the hyoid bone, that is known as infrahyoid artery. That is known as infrahyoid artery. So there are also branches going to the sternocleidomastoid. Let's ignore them. Superior laryngeal, and then there is this branch that is going to supply cricothyroid muscle right here. So this is known as cricothyroid artery. This one. And then we are left with the one that is actually going to the thyroid gland. That is the part that is going to the thyroid gland. It is further divided into the anterior division that is go to the anterior surface, and the posterior division that goes back, and then one of them will go to the isthmus and all that. So superior thyroid, talking about the superior thyroid artery, I discussed the branches. There is infrathyroid artery, the superior laryngeal artery, the one that is going to the cricothyroid, the two anterior and posterior divisions of the thyroid, and there is one going to the sternocleidomastoid also. Okay, let's erase this. Let's talk about the next ones. Ascending pharyngeal artery, there is not much to talk about. In this particular picture, you can see it right here. It is going back and up on the lateral aspect of the pharynx, and it will move in the pharynx and it will supply this. Lingual artery, let's follow the lingual artery a little. Let's follow the lingual artery and leave it for the oral cavity. Okay, here is the lingual artery, the one that is running right here. The lingual artery, it arises at the level of the hyoid bone, where the tip of the hyoid bone is at meeting near the common external carotid artery. It goes back. The muscle relation that you have to remember is this one. The muscle that is present right here, this one, this muscle, this is the hyoglossus muscle. We will discuss about it in the oral cavity lectures. This is the muscle that is moving from the hyoid bone and it is moving to the glossus, the tongue. So that is known as hyoglossus muscle. So there are two MCQs regarding the lingual artery. One is that the lingual artery, it goes to the medial aspect of the hyoglossus. It will go inside the hyoglossus and it will go into the oral cavity region. If it stays out, it won't be able to go to the tongue. So there is one question, it is medial to the hyoglossus. And the second question we discussed earlier, the relationship with the hypoglossal nerve. It's the relationship with the hypoglossal nerve. The hypoglossal nerve just passes lateral to the lingual artery. So this is about lingual artery that I wanted to discuss. If you are interested, and if you are not interested, then you can forget it also. It has a small branch that moves on the upper aspect of the thigh bone. So simply speaking, its name is suprahyoid artery. So this is about lingual artery. Facial artery is complex. Facial artery is complex a little. Let me get it to the chin, and from the chin aspect here onwards we will discuss. In the facial artery we will discuss separately. So it arises right here, it moves to the front, and before it reaches the lower margin of the mandible, before it reaches the submandibular fossa, it gives rise to two branches. These are the branches, I'm just naming them because they will be important to you when we're talking about pharynx. So these are the branches that are going upwards. You don't have to remember a root of a lot by very detail. These are known as, one of them is going to the palate, ascending palatine artery, and one of them is going to the tonsillar bed. So this is the ascending palatine artery. It is going all the way up on the lateral aspect of the superior constrictor, up across it to the palate, and this is the one that is going up through the superior constrictor into the tonsillar bed, tonsillar fossa. So these are the arteries. Then it enters the submandibular fossa. Submandibular fossa is the same as the submandibular space, the submandibular triangle, the digastric triangle that we discussed in the previous lectures. It gets on the basically on the medial aspect of the submandibular gland, and it of let's talk about this picture. On this picture, if this is the submandibular gland, this is the lateral aspect, this is the medial aspect. This is the lateral, superior, medial, inferior aspect. Facial artery comes from back. It approaches it from the posteromedial aspect. It curves above it on the superior aspect, goes over it to the lateral aspect, and it reaches the lower margin of the mandible. So it is the relation. The facial artery, it moves from the posteromedial aspect to above and to the lateral of the submandibular gland before moving into that. So this is the curve that is shown right here. It is moving posteromedial aspect, it is above and lateral to the submandibular gland, and it reaches the lower margin of the mandible. And at the lower margin of the mandible, you can palpate it like here. There are two ways to palpate it. Clench your teeth. If you clench your teeth, you will be able to figure out this muscle. This is masseter muscle. You won't be able to very much identify it in the flaccid position, but if you clench your teeth, this is the masseter muscle. Just follow its anterior margin and get to the point where it meets the margin of the mandible. So this is the point where you will find the pulse of the facial artery. And the second thing is that at this point, the bone has a little notch. Some people have a little, most of the people have a notch like this. So if you palpate the lower margin of the mandible, you will feel a little gap, a little dip, a little notch right here. So in the notch, you can palpate the artery. So this is the facial artery. So we talked about the branches of the superior thyroid arteries: infrahyoid, superior laryngeal, pericothyroid, anterior posterior thyroid, and sternocleidomastoid. We talked about lingual artery originating at the tip of the hyoid bone, at the greater horn of the hyoid bone, giving rise to suprahyoid artery and going medial to the hyoglossus, and it is itself medial to the hypoglossal. And then we talk about the facial artery. It is originating just opposite to the occipital artery anteriorly. Before reaching the submandibular fossa, it is giving rise to the tonsillar and ascending palatine arteries. They are going to the areas of the same name. Then it is moving over and to the lateral of the submandibular gland to reach the lower margin of the mandible, and from it moves up. Here you can actually feel the pulse of the facial artery. And before actually entering the face, it gives rise to this artery. This is the artery that moves all the way here and just supply at the lower margin of the mandible. That is known as submental artery because it's going to the submental triangle. is a submental artery. So these are the branches of facial artery that we forget to talk about because we are so much fixated on facial artery being on the face. So this is the facial artery. Then the occipital artery was the one that was going on the back. I talked about the hypoglossal nerve winding around it. Then there is this posterior auricular artery moving on the anterior margin of sternocleidomastoid, leaving the tip of the posterior triangle and going on the back aspect of the chest ear. And then there is superficial temporal artery, and then there is maxillary artery and maxillary artery, a hell of lot of branches. So we will talk about them when we're talking about the infratemporal fossa in detail. I'm just going to show you how many branches are originating from maxillary artery. All you can see right here. So just don't go into the detail. So here, so we are done with external carotid artery, or at least I hope we are done with the external carotid artery. So you can take a, if you want to take a little breather, but let's do the internal carotid artery, then we'll take a little break. Okay, then we come to the internal carotid artery. In this picture, you can see the arch, the big common carotid, the bifurcation, the external carotid with all of its branches, and on the back, this is the common carotid artery. Common carotid artery, it moves inside the carotid sheath. That is the interesting thing. That is the thing that we remembered, that common carotid artery, it's a part of the carotid sheath. But as soon as it bifurcates, the external carotid artery, it goes out of the carotid sheath, but common carotid artery continues. Common carotid artery continues all the way up in the carotid sheath, and it enters the carotid canal on the base of the skull that we saw in the first lecture of the head and neck. The thing that you remember, and the thing where the examiners, including me, intend to confuse their student, is that they ask what are the branches of the internal carotid artery in the neck. So be very, very clear that there is no branch of the internal carotid artery in the neck. So internal carotid artery has no branches in the neck, and that's it. That's the thing to be remembered. And it moves up the carotid canal. It's basically a discussion for the vasculature of the brain, but just giving you an overview, a very quick overview. It enters the carotid canal, moves through it anteriorly, exits the upper end of the carotid canal in the middle cranial fossa between the two clinoid processes into the cavernous sinus. It runs anteriorly to the cavernous sinus, makes a loop between two clinoid processes, then it gives rise to its branches. The one that is going to the eye, ophthalmic branch, the anterior cerebral, the middle cerebral, the posterior communicating, and the anterior choroidal arteries. So these are the branches, but I'm not going to discuss them in detail. I think I have not written the here there is also anterior choroidal. So there is a choroidal artery also. So what are its relations? इसके किस किस से ताल्लुकात हैं? So common carotid artery gives rise to the internal carotid artery. So what are the structures that are lying posterior to it? What are the structures lying anterior to it, lateral to it, and medial to it? As it's lying on the angle of the neck, we usually combine the relations that are present on the lateral and the anterior aspect, because the sternocleidomastoid and these structures are passing like this on the lateral aspect and the anterior aspect also. So let's look at the back. On the back, there is running of the this nerves. There is a sympathetic chain that is running on the back of it, and there is on the posterior aspect, the superior laryngeal nerve that is running behind it, because the vagus nerve is running on the little posteriorly to it, and the other muscles are behind. The relation that you must remember about the carotid canal is the with the internal jugular vein. The internal jugular vein is always lateral to the internal carotid artery. Not always, technically, on just in the base of the skull where it's exiting the base, the artery is anterior, the vein is posterior, but they quickly change their dynamics, and as they go down, the artery is medial and the vein is lateral, and the vagus nerve is in between them throughout. And this relation is very important from the clinical aspect, because there is a lot of times you have to cannulate the internal jugular vein. for venous access, for maintaining central venous pressure, and even to pass the catheter to the heart to various procedures. So you palpate the common carotid artery, you palpate the internal carotid artery, and you pass the cannula just lateral to it into the internal jugular vein. So this is one of those relations that is not forgivable if we forget them. On the medial aspect, on the inner aspect, the ascending pharyngeal artery is there. On the lateral aspect, majorly the branches of the external carotid are coming in front of it. Like you can see the hypoglossal nerve, this hypoglossal nerve is passing lateral aspect of the internal carotid artery, and the ansa cervicalis, I think almost all the veins, like all the veins like facial vein, lingual veins that are making the common trunk, the thyroid veins, inferior thyroid veins, all of these are crossing the artery laterally, and a lot of the nerve branches, the chief one including the hypoglossal nerve and this ansa cervicalis, and of course there is a lot of pharyngeal laryngeal branches. Actually, that is not the branches of the cervical plexus, basically pharyngeal plexus. Here you can see pharyngeal plexus. So they are moving across the lateral aspect. So there are a lot of structures going on the lateral aspect. You can remember them: internal jugular vein, vagus nerve itself, lingual facial, ascending cervical. And you move up, you can see the belly of digastric moving on the lateral aspect. External carotid artery is on the these are all of these muscles arising from the mastoid and the stylotosis. These are on the lateral aspect of this artery. So internal carotid artery, the branches. So we are moving here to the last branch, last artery that is important. I won't be talking into the detail the relations very much, but I will be talking about their branches. So the branches that are coming from this is subclavian artery. Okay, subclavian artery. Subclavian artery is the one that is coming from the arch of aorta on the left side, and it is coming from the bifurcation of the common carotid, bifurcation of the brachiocephalic trunk on the right side, and directly from the arch of aorta on the left side. This breakage, this bifurcation is happening behind the sternoclavicular joint, and so let's see. So it comes out when it originates, it is divided into three parts on the basis of this muscle, anterior scalenus muscle. On the basis of anterior scalenus muscle, it is divided into three parts. The part that is medial to it will be the first, behind, second, lateral, third. So there are branches. So these are the parts. Let's talk about their. There is no name of the parts, and the relation with the scalene and the anterior and starting and ending points. Let's talk about the starting point, ending point, and the termination point. I just talked about the starting point. It starts from the point where it bifurcates on the right side and where it originates from the arch of aorta on the left side. It does not have an anatomical landmark, anatomical ending point. We have on a base of level, we have defined it. Just this is the first step, this is the lower margin of the first step. Just as it crosses the lower margin of the first step, this is the point where we stop calling it subclavian, we start calling it axillary. When we are studying the upper limb, we discussed that axillary artery was starting from the later margin of the first step. So that is the same definition that goes to the ending point of the subclavian artery. So this is it. It has three parts. It is starting from it. It is ending here. It has three parts, and we have discussed multiple times now that it is behind the scalenus anterior. I discussed with you in a previous lecture also. The relation with the scalenus anterior is very commonly asked. So a question can come like, artery is anterior to the scalenus medius, artery is posterior to the scalenus anterior. Scalenus anterior is between the subclavian artery and subclavian vein. Subclavian vein, it passes in front of this. And these relations, especially the subclavian veins and subclavian artery relation, which of them is lying anterior and posterior, and what is the relation with subclavian anterior? This becomes important clinically because subclavian vein is another one of the major veins that is cannulated for major venous access. Okay, enough about the parts, its relation with the scalenus and origin and termination. let's talk about the branches that are originating from here. The branches. The branches that are originating from here are the one is the important one that you have studied in the thorax region, that is one that is going down into the thorax, that is the internal thoracic artery. The internal thoracic artery that is going down, it will go down in front, in just behind the costocartilages, just later to the sternum, and it will go down up to the diaphragm, and at that level it will break into musculophrenic and superior epigastric, and that's a whole discussion there, but let's keep it here that internal thoracic artery comes from here. The second artery that is, actually I should have mentioned it as the first, that goes upwards, that is known as vertebral artery. Vertebral artery goes up here, you can see it goes up. Just focus, let me get the arteries first, then we will discuss them one by one. And the third artery that is arising here, that is this thyrocervical trunk, that is known as thyrocervical trunk. So these are the arteries that are originating from the subclavian trunk. So let's talk about them one by one. Internal thoracic artery I won't be discussing in much detail, but let me give you a very brief preview of the internal thoracic artery. It originates and it goes down behind the costal cartilages, moves down parallel and lateral to the sternum, and it will go down supplying the anterior intercostal arteries, supplying the anterior perforating branches, and it will go down to the sixth space, and then it will bifurcate into musculophrenic and superior epigastric artery. And this is the artery that is having the internal memory group of lymph nodes along with it, and it is the artery that is used for the coronary bypass surgery. You break the artery free from the lower end and you attach it to the coronary artery distal to the blockage. Enough about internal thoracic artery. Let's talk about vertebral artery. Let's first just talk about its route. Vertebral artery is the one that moves up, and this is the artery that occupies the foramen transversarium of C1 to C6. Just get a focus here. It is not passing through C7. So it will move up through the foramina of the C6, 5, 4, 3, 2, 1, and you can see the transverse process of foramen 1 is on the lateral, so it will do a curve right here, and this curve becomes important radiologically. When you are looking at angiograms, you see this curve going, and after the curve it will dip inside along the arch of the atlas, and it will move between the occipital bone above and arch of atlas below, and it will move into the foramen magnum, and it will go into the brain. And in the brain, in the cranium basically, in the cranial cavity, it will move on to the anterior aspect of the medulla oblongata, both them, and they will join at the upper margin of the medulla oblongata to form the basilar artery. And then the whole discussion goes, what are the branches of the basilar artery and how the basilar artery ends by breaking into the posterior cerebral arteries. There's a whole discussion of the cerebral circulation. But one thing that comes back to the head and neck is that this vertebral artery, it gives rise to two branches that unite in the midline to form the anterior spinal artery. It moves in the vertebral column with the spine on the anterior aspect, and there are separate posterior cerebral arteries that are moving on the back aspect of the spinal cord. So this is about vertebral artery, its branches. But these are not the only branches. In the neck it has a lot of branches also, but they are not very bigger one and individualistic. They are very small branches supplying a lot of things. So there are meningeal branches that goes through these foramina, intervertebral foramina, to go into the meninges of the spinal cord. It has posterior, and it will have anterior and posterior spinal arteries that will go and supplement. It will have radicular arteries that will go and supplement in the posterior spinal arteries. We just discussed the anterior posterior spinal arteries coming from down, and it will have branches in the brainstem. So these are most of the branches that are discussed in the brainstem. I'm trying not to go there, but it will supply the muscles here, it will supply the meninges here, it will supply the spinal cord as well. It will go along. Then there is this thyrocervical trunk. Thyrocervical trunk, it's the one, by the name you can see, thyrocervical trunk is going to supply the thyroid gland, and it will going to supply the cervical region, the neck region. It goes up thoracocervical trunk and it gives two branches on the lateral aspect. There is suprascapular artery. It will move back and go and move above the superior margin of the scapula on the suprascapular notch. It will move above the suprascapular ligament. That's a discussion for upper limb. The anastomosis around scapula, if you have in mind. Then there is transverse cervical artery. It moves laterally and it goes and supplies the lateral aspect of the neck. Okay, let me move to the 3D model. Let me set it up. Okay, so let's try to follow all these structures here. I will have to add them one by one. I hope so. You can stay with me during this. Okay, let's add internal thoracic artery. Okay, let me do a little. Let me do the other parts of the subclavian artery also. Then we will do them in block. So subclavian artery, I talked about the three first part. First part had three branches: internal thoracic, vertebral, and the thoracocervical trunk. It has further three branches: inferior thyroid arteries, superficial cervical artery, and suprascapular arteries. Then the branch that arises behind the second part, that behind the scalenus anterior muscle, that is called costocervical trunk. That is called costocervical trunk. It rises just behind the scalenus anterior and it goes back over the root of the lung. It goes back over the root of the lung, costocervical trunk, and it gives rise to two branches. And when it goes back, one branch moves down, one branch moves up on the back aspect of the neck. The one branch that moves up on the back aspect of the neck is this one, the deep cervical artery. It moves up and it supplies the muscles of the back of the neck. And the one part that goes down on the back aspect, this is called highest or supreme intercostal artery. You may have a little memory of it from the thoracic region when we studied that the first two branches, the first two thoracic arteries and posterior intercostal arteries are coming from the superior intercostal arteries. Then there is a third part. Third part usually does not have a branch, that it may or may not have a branch, and that branch is called dorsal scapular artery. Dorsal scapular artery. Okay. Let's take a 2 minute break here. Let's take a more break here. Let's take a 5 minutes break here. Stretch your legs. Think other things. I will come back after 5 minutes, inshallah, and I will set up meanwhile the 3D model. Will re-go through this topic, and then we will move on to the venous structures. There is one controversy regarding the dorsal scapular artery and deep cervical artery. We will discuss it then, inshallah. Let's take a break here. What's the time with me? I have 6:06. Let's commence again at 6:10 p.m. Okay. Okay, let's start from where we left off. Okay, let me, before jumping into the next topic, let me give a little detail. Let me, okay, let me just do one thing. Okay, let me search the model. Let's quickly revise what we just studied about the three parts of the subclavian trunk and the branches and all that. First, we discussed the internal thoracic artery. I thought I just, okay, we are ready. Let's go. So, this is the part of the subclavian artery, the part that is behind on the medial aspect, the part that is behind, and the part that is lateral. And it is ending at the upper margin, lateral margin of the first rib. So let's look at the, this is, I have labeled all the pictures on the left aspect, left side. So let's look at the branches. So the first branch that is going to the anterior aspect, that is the internal thoracic artery. This is the branch, the internal thoracic artery that goes back. Let's back out a little and then look at the ascending branch. This is the vertebral artery. It's a little difficult to see it with the muscles on. Let's fit this structure. Let's, okay. So now I think it would be better visible here. This is the vertebral artery. So it is going here. You can see it through the scalenus anterior. It is going through the vertebral canals. Here you see it is not passing through the last foramen. It is moving 3, 6, 5, 4, 3, 2, 1 all the way to the top. And you top in the, if you follow it to the top, it makes a loop, outside loop here. It goes outside to go into the transverse foramen transversarium. Then it moves behind the atlanto-occipital joint and it moves in the posterior arch of the axis, and here it is entering into the foramen magnum. It is entering into the foramen magnum. Here it will join to the vertebral vein on its opposite side and form the basilar vein. So this is the vertebral vein for you. It has the meningeal branches, spinal branches, and all that. Let's look at the other structures that were coming from here. We had this branch. This is thyrocervical trunk. Itself, it's a very small, maybe a centimeter or a little more, and it has a very important branch that goes above, on the above, that is the inferior thyroid artery. It is like a loop. It goes up and goes medially behind the thyroid gland, and medially it has very important relation. It moves behind the common carotid artery. This is the common carotid artery. So it moves behind the common carotid artery, and you will read the name of this artery when talking about the posterior relation of carotid sheath and posterior relation of carotid arteries. It moves behind it and it goes like a loop and it goes into the lower lobe of the thyroid gland. Then there are two arteries. Okay, here, this is the one that goes to the top of the scapula. This is the one that goes here and it moves just above the suprasternal notch. And this is the one you read about in the anastomosis around scapula. This is that artery. It moves, and then there is this artery that is transverse cervical artery. It again moves laterally on the upper part of the thoracic cage, rib cage, and it does not this one, this one, this one. This is the one that is moved above it and goes to the back aspect. And this is the artery that you again read about in the thoracic cage. It moves, winds around or sometimes through the scalenus muscle. It moves under the latissimus, the levator scapulae, and it goes all the way down and it gives rise to this artery, dorsal scapular. Let me talk about this controversy also. Okay. Now you have seen written here the superficial cervical artery and the suprascapular artery, and here you are seeing the transverse cervical artery and no superficial cervical artery. So there is a discrepancy. It rises and it causes a lot of confusion when people who have read different books discuss this topic with one another. Normally, what happens is that, let me get my notes little here. Normally, what happens is that through the thyrocervical trunk, there arises, let me here, let's do thyrocervical trunk, and from it, there arise inferior thyroid. It goes like this, and there arise suprascapular, and there arise transverse cervical. Simple. And that was a subclavian artery. This was a subclavian artery. Okay, so this is happening. The transverse cervical, as it goes to the back, it usually divides into two branches. It has a superficial branch and it has a deep branch. Deep branch is the one which divides, which form the dorsal scapular artery. It forms the dorsal scapular artery. Please forgive my writings. And this one goes to the back of the scapula. But there is a variation. Sometimes what happens is that there is subclavian artery, there is thyrocervical trunk, there is inferior thyroid artery, and there is suprascapular artery. Okay, but one thing that happens is the dorsal scapular artery arises independently from the third part. First part, second part, third part. Dorsal scapular sometimes arises independent in the third part. When it arises independently in the third part, the branch that was coming from here, it does not have to now divide to form two things. It does not have to give the deep branch now. It only has to give the superficial branch now. It only has to give the superficial branch now. When it gives a superficial branch now, you don't have to name it the transverse. It is totally named as a superficial cervical artery. So that is why when talking about the branches of the thyrocervical trunk, you may get two different views. These two are solid, inferior thyroid and suprascapular, but you may give the third one one of these two. In some books there is transverse cervical, in some books there is, sorry, not this, there is superficial cervical. So here is where the controversy lies, and the reason behind it. And in the books where you will read superficial cervical, you will read the dorsal scapular is the branch of third part, and in the books where you read the transverse cervical, you will read that the third part of subclavian artery don't have any branches. So that's it. And here you can follow the same thing. This is the picture. The text is from the Snell Anatomy. The Snell Anatomy has written superficial cervical artery, and it has written that there are no branches in the third part of the subclavian artery. And here is a picture from the Grays, and the same situation is made in the graph, that there is the transverse cervical artery, it goes to the superficial, and there is dorsal scapular artery. So that is the situation that is shown in this model right here. So that is a situation that is made in this situation here, that you can see here, the dorsoscapular artery, it's originating independently from the third part. See subclavian artery, the last part, the third part, and here you can see the originating dorsoscapular artery. And because it's originating dorsoscapular artery, you will see it moving on the middle aspect of the scapula. And here you can see this artery. This is independent. This is will be known as transverse cervical artery, or here it will be known as superficial cervical artery, because it does not have to go and make the deep branch. It does not have to give origin to the deep branch. So this is about the branches of the subclavian artery. Let's talk about the veins. So here is a picture of the okay. Here is the picture for the, let me get to the ahead of it. Okay, here is a picture that is summarizing all of these things. Okay, the relation vertebral artery and all that. There's a latest pictures that gives the all the branching arterial tree. Let's move on to the veins of the head and neck. Veins of the head and neck. Overall, the veins of the head and neck, they may be divided into the veins of the brain. These are the veins that are supplying inside the cranial cavity, and they are cerebral veins, brainstem veins. We're not going to discuss those. There are venous sinuses, dural venous sinuses. That's a whole other topic. Diploic veins, the veins that runs between the two tables of the calvaria. And then there are emissary veins, then the veins that are passing between the veins of the dural venous sinuses and the veins on the top of the skull. So these are the veins of the head and neck. And then there are a number of veins of the scalp or face: the facial veins, superficial temporal veins, maxillary, retromandibular, external jugular, anterior internal jugular, subclavian vein, that we are going to discuss right now. Okay, so these are the set of veins that we are going to discuss. This is the diploic veins that are running inside the two tables of the bone, the scalvaria. These make an anastomosing network, and they are not very properly labeled, properly defined, but because they make a very vast network of veins, let's discuss these. Let's start from here. I think I did one. I Okay, we will discuss facial artery with the face inshallah tomorrow. Okay, facial veins. Facial vein will be the one that will be on the anterior aspect of the face. It will have a similar pathway to the facial artery. It will be running from here, from the medial aspect of the ear, on the lateral aspect of nose to the lateral aspect of face, and it will come here and down to the internal jugular vein. So this is the facial veins, and superiorly facial vein is may, being made by the fusion of the supraorbital and supratrochlear veins, and they make join to form the facial vein, and they come down and they move from the lateral aspect of nose to the lateral aspect of mouth, and they go and they join with the lingual vein, usually to form the common facial veins, and they drain into the internal jugular vein. Okay, that is the lingual vein and internal jugular vein is formed. The interesting thing that is to be seen here, we have not discussed yet the dural venous sinuses, but the facial vein, it is connected to the ophthalmic set of veins, to the superior and inferior ophthalmic veins, to the cavernous sinus. So the facial vein is connected to the cavernous sinus. So its implication is that there is the infections from the face, the trauma, the pathogens entering from the face can go through these ophthalmic veins and go to the cavernous sinus to create a cavernous sinus thrombosis. So this is about the facial vein, and then there is this superficial temporal vein. This is a similar one that had the artery, and it similarly it receives the maxillary vein to the superficial temporal vein, like here. and where the maxillary vein joins the superficial temporal vein. Now, this is called the superficial temporal vein. It joins the maxillary vein, and now it is called retromandibular vein. Just be aware of the fact that here the names and the arrangement does not correspond very nicely to the arterial system. Originally, external carotid artery was dividing into maxillary and superficial temporal, but in case of veins, the superficial temporal veins and the maxillary vein, they join to form the retromandibular vein. When the retromandibular vein comes down just behind the angle of the jaw, here it divides into two parts. The one that is going anteriorly and posteriorly, these are simply called the anterior and posterior divisions of the retromandibular vein. Okay, the anterior division of the retromandibular vein, it joins with the facial vein and lingual vein sometimes, and they make the common facial vein. And this is the common facial vein that goes into the internal jugular vein. Sometimes the lingual veins join the facial veins before, and they too join the anterior division of the retromandibular vein, and sometimes facial vein joins the anterior division of the retromandibular vein. After that, the lingual vein joins them. But in any case, they join with the retromandibular vein joins the facial vein to form the common facial vein, and they drain into the internal jugular vein. Okay, moving on. So this is shown the same situation. The facial vein is shown a little more clearly in respect to the structures of the face. That is the supraorbital vein, supratrochlear vein joined from the facial vein. It is connected with the veins of the orbital cavity, moving on the lateral aspect of nose, lateral aspect of lip, moving through the jaw. Here it is joining with the anterior division of retromandibular vein to form the common facial vein, and it is joining into the internal jugular vein. And here superficial temporal vein is shown to receive maxillary vein to form the retromandibular vein that is dividing into anterior and posterior division. External jugular vein. External jugular vein, how it is formed. We just talked about retromandibular vein. In this particular picture, here is the retromandibular superficial temporal vein. This was the maxillary vein. They joined to form the retromandibular vein. They joined and okay. The retromandibular vein comes down. It divides into two divisions, anterior and posterior division. Anterior division was joining with the facial vein to form the common facial trunk. The posterior branch, it moves back, and posterior branch joins with this vein, the coming from the back of the ear. It has the same name. This artery, this vein is called posterior auricular vein. This vein is called posterior auricular vein. Posterior auricular vein joins with the posterior division of retromandibular vein, and they two join to form the external jugular vein. And external jugular vein, it goes down, it crosses vertically like this. It crosses from lateral margin of the sternocleidomastoid to the anterior margin of the sternocleidomastoid, and on sorry, it crosses from the anterior margin of the sternocleidomastoid to the posterior margin of the sternocleidomastoid, and just on the back aspect of the sternocleidomastoid, it winds around it and dips to join the internal jugular vein. Sometimes it may join the subclavian vein also as shown in this particular picture, but usually it joins the internal jugular vein and is coming down. What are tributaries it is receiving? Two tributaries are the one that are forming the structure, that is the posterior auricular vein and the uh, posterior division of the retromandibular vein. Apart from it, as you move down, you can see other structures joining it. These include the transverse cervical and superficial suprascapular vein, the ones that with the same arterial names of the arteries we discussed, and it may also drain the anterior jugular vein. So this is the external jugular vein. It is shown right here, and here the anterior jugular vein is shown. It is running on the anterior aspect of the neck, and the two internal jugular veins are joined with one another with an anastomosing arch. And this apart from this arch, a branch it goes laterally anterior jugular vein behind the sternocleidomastoid and go to join the external jugular vein. This was about the jugular arch. The this is the jugular arch. The anastomosing arch that joins the two internal jugular veins, anterior jugular veins, it's called the jugular arch. Internal jugular vein. Where does it start? It starts from the point where it exits the jugular foramen in the skull, where it exits the posterior aspect of the jugular foramen. From here, it goes down and it enters the carotid sheath. From that point it moves down the carotid sheath all the way down, and it ends where it meets the subclavian artery, and it ends where it meets the subclavian sorry it ends where it meets the subclavian vein to form the brachiocephalic vein. So this is the terminating point of it. So what are the tributaries it is receiving? So it is not shown in the very good in this particular picture, but as soon as it exits the jugular foramen, it receives the inferior petrosal sinus. You must be thinking petrosal sinus, it's inside the cranial cavity, but usually it fuses with that jugular vein after passing through the jugular foramen on the neck aspect. So its first tributary is usually the inferior petrosal sinus. As we go down, you can see different veins that are draining into it. There is ascending pharyngeal vein, counterpart to the artery. There is common facial vein, there is a lingual vein, sometimes through a common trunk, sometimes separately. Then there is spherothyroid veins from the thyroid, then middle thyroid vein from the thyroid, and these are the veins that are draining into the internal jugular vein. The relations of the internal jugular vein is a commonly asked exam question. Internal jugular vein, anteriorly, it is related to all the structures that lead to the skin. So if we move from front back, there is a skin, superficial fascia containing platysma, then there is this muscle, sternocleidomastoid, and if we move from up, um, sorry, if we move see from upwards, here internal jugular vein is behind this set of area. It is behind styloid. It is behind posterior belly of digastric. It is behind the angle of mandible. It is behind the parotid region. So all of these structures are related to it anteriorly. All of these structures are related to it anteriorly. So this includes styloid, posterior belly of digastric, and parotid gland. And anteriorly, it is related to the strap muscles, especially omohyoid, it's just anterior to it. And very important point to remember is that the tendinous arch where the two bellies of omohyoid meet, where the superior belly of omohyoid meets the inferior belly, this point is just in front of the internal jugular vein. And this is a very important surgical landmarks that help identify this vein. Then there is accessory nerve that is running in front of it. I think it is not very nicely shown here, but it may be shown. Yes, accessory nerve, it moves from front to back across the jugular vein right here. So it is shown right here. It moves from front to back right here, so it is anterelation of it. And then there is deep cervical lymph nodes and ansa cervicalis that is moved from the anterior relation. So these relations we just talked about are both of the anterior and the lateral aspect. So these are more technically the anterolateral relations of the internal jugular vein. Posteriorly, which structures are related to it? Posteriorly, if we see through a radiogram, if we see through a venogram, it is related to the transverse processes. Just the transverse processes are behind it. Then there is a set of these muscles, the lateral group of prevertebral muscles, scalenus anterior, scalenus medius, and the highest point, levator scapulae. This is behind it. And if we consider looking through the scalenus anterior, cervical plexus, and in the lower part brachial plexus is in the posterior relation. As internal jugular vein is running in front of the scalenus anterior muscle, so any structure that is on the anterior relation of the scalenus anterior will also be related to it. So that includes the phrenic nerves moving along the anterior surface of the scalenus anterior. That includes the prevertebral fascia that is adherent to the anterior layer of bone. Then there is vertebral artery, vertebral vein, and first part of subclavian artery. It moves behind it, and you can see the thoracic duct as it moves, jumps from back of the thorax over the subclavian artery and join the subclavian vein. It is moving behind the internal jugular vein too. So these are the structures that are related to the internal jugular vein. Medially, it is related to the internal carotid artery, and in between them there is a vagus nerve. That is the most common that you have to remember. That in medial to the internal jugular vein there is carotid artery. On the upper aspects there will be common carotid, upper internal carotid, and the lower aspects there will be common carotid, and in between them there is vagus nerve, that is the throughout, and in the earliest part there is the rest of the cranial nerves, but they separate very quickly and very early, so you don't see this relation throughout. But in the very early parts, the rest of the nerves are always already also there. So this is all about the veins and the face and scalp. We talked about facial vein. It started by joining of supraorbital and supraorbital veins. We talked about ophthalmic veins joining them to cavernous sinus right here. Superficial temporal vein, we talked about it, and it accompanies superficial temporal artery and auricular temporal nerve. It joins the maxillary vein to form the retromandibular vein. They divided into anterior and posterior division, and it joined the facial veins to form the common facial vein, and posterior division joined the posterior auricular to form the external carotid that moves across on the superficial to the sternocleidomastoid. It received a number of tributaries and it joined, including the anterior jugular vein, and it drained into the internal jugular vein. And then they would talk about the relations and tributaries of the internal jugular vein. So that's all about the venous structures. Then let's review the lymphatics a little. I will be talking about the lymphatics of the head also because I want to cover this whole topic. So um, the we can talk about, when we are talking about the lymph nodes in the books, different approaches are taken to discuss the different parts. Usually a regional approach is taken where we talk about the lymphs behind the larynx, behind the pharynx, retropharyngeal and region wise. And sometimes we talk about the rings, the horizontal rings, the ring that is making on the facial aspect. There is a ring of lymphatics, and there is another ring inside, and there are vertical chains that are deep cervical nodes. We will talk about them. So we will talk about the regional aspect. We will talk about the superficial nodes of the head, deep nodes of the head, superficial nodes of the neck, and deep nodes of the neck. Let's like this is the regional aspect. Let's talk about the lymphatics. First of all, the occipital nodes. These are nodes on the back of the head in the occipital region, and they are on the apex of the posterior triangle. And as you can see, it is receiving the fibers from the back on the back of the head from the vertex, and it itself it drains into the deep group of cervical nodes. Then move on to the retroauricular nodes. These are nodes that are behind the ear, retroauricular. And if you move your finger behind the auricle, you will see that the bone that is present here is mastoid bone. So that is the mastoid group of lymph nodes and retroauricular group of lymph nodes. So they receive the area moving up. So it is draining the area of the scalp that is behind the ear all the way up to its tip of it. And some of the external ear and external meatus is also coming from here, and also drains down to the deep group of cervical lymph nodes. Then we come with the parotid preauricular region. Preauricular parotid nodes, as you can see, the two names, it is preauricular. They are present in front of the ear, preauricular, and they may be present on the top of the parotid gland. So these are parotid or preauricular nodes, and they receive lymphatics from the ear, from the forehead, from the temple region. An easy way to remember is that if you have an idea about this picture, thus horizontal, these lines like this lines, roughly the pathway of the facial artery, like this. So this is defining the area of the parotid nodes. The part lateral to it, it is draining into the parotid nodes. The part medial to this line, it is draining into the submandibular and submental group of nodes. So the area that is lateral to it, it will go to the parotid and preauricular nodes. The part that is medial to it, it will come down and it will drain into the submandibular nodes and submental nodes here. And here 4 teeth, 4 incisors, this area. Four incisors, they go into the submental nodes, and beyond the four incisors, they go into the submandibular nodes. So this is the parotid group of nodes. It is receiving the lateral aspect of the temple, lateral aspect of the orbital cavity, lateral aspect of the forehead, the temple region, and a part of the external auditory meatus, especially the anterior one. And it is itself, it is going and draining into the deep group of lymph nodes, deep cervical lymph nodes. Then there is a buccal nodes. There is an additional group of nodes right here on your cheek, buccal nodes, and they are close to the facial veins. They drain part of the nose and eyes and the ear, that is area that is near to it. It is draining along the facial vein down to the submandibular group of nodes. Then there is submandibular nodes that are present in the submandibular fossa, in the submandibular region, beneath the investing layer. Some are outside it also, and it is shown in both of these picture here. And it is receiving the lymphatics from the buccal nodes. It is receiving from the submental nodes. So everything that was beyond inside this line. So nose complete anterior aspect, upper jaw, lower jaw, and so cheek area. So all of these, and these include the face of the scalp also. So the front of the scalp, nose, external sinuses, upper lip, lower lip, and teeth. All of these are coming into the submandibular group of nodes. Different, it going to the deep group of cervical nodes. Then we are left with submental nodes. It is present just in the submental triangle. It is receiving, if you make a triangle from the four incisors to the tip of the tongue, so that triangle, the lip middle part, four incisors all the way to the tongue. So this floor of the mouth, this is draining into the submental nodes. Most of them, they do drain into the submandibular group of nodes, but some of them, they do go directly into the deep group of cervical nodes also. Then we are left with anterior cervical nodes, not very clearly shown in this very picture. They are placed somewhere here near the anterior jugular nodes, and some of them are in the suprasternal space. Usually the suprasternal space was the cavity in the investing layer of deep cervical fascia just above the jugular notch, and the infront one goes, they go down to the deep cervical nodes, and they go into the prelaryngeal and tracheal nodes. So they are shown here along the running across along the anterior jugular vein. Then there is a retropharyngeal group of nodes. They are present on the back of the pharynx, and the retropharyngeal nodes are present behind the visceral fascia, buccopharyngeal fascia, in front of the prevertebral fascia. And the clinical importance was that the purulent, the infection will lead to the infection of the prevertebral space, and they drain the back aspect of the oral cavity, the back aspect of the nasal cavity, and the pharynx also. Nasal part of the pharynx, soft palate, hard palate, nose, auditory tube, and cervical vertebra, these are drained by this structure. And laryngeal, prelaryngeal nodes are in front of the larynx, deep to the nesting layer, and deep to the muscles that are covering, that are suprahyoid, infrahyoid muscles, and they drain the structures that are indicated by the name, that is larynx, and trachea that is near to it, and they go to the deep cervical nodes. And then we are left with tracheal. The nodes that are anterior to it, that will be pretracheal. The nodes that are later to it, that will be paratracheal, and they will be draining structures from the trachea itself and the neighboring structures, and they will drain into the deep group of cervical nodes. This is the whole area. Now let's talk about the vertical groups. There is a superficial and deep. Superficial lymph nodes are present on the outside. They are present on the outside of the sternocleidomastoid. They are present along the external jugular vein, and they drain the area here, right around here, along the angle of the jaw, of the apex of the parotid, lower end of the parotid gland, lower lobe of the ear, floor of the external artery meatus, and they go and drain into the deep group of inguinal nodes, not cervical nodes, sorry. Have I been talking about inguinal nodes? Okay, then there is deep group of cervical nodes, and they run along the internal jugular vein, and they run all the way from the base of the skull to the root of the neck, and they are embedded within the carotid sheath. These are one of the contents of the carotid canal, carotid sheath, and they are divided into the upper superior cervical group, they are divided into lower cervical group, and the upper group does contain one important lymph node that is known as jugulo-digastric node, and the lower group contains one important one that is known as jugulo-omohyoid node. So jugulo-digastric one is present in the upper group. It is below the posterior belly of digastric in front of internal jugular vein, and it's behind the angle of mandible, right somewhere here. So it is the one that is draining the posterior aspect of tongue and tonsils. So it is very important in tongue. And the other one is the jugulo-omohyoid. It is present below, and it is just above the intermediate tendon of omohyoid, just where it crosses this area, and it drains the tongue also. So most of the tongue was drained into here directly. Some of it was going to the jugulo-digastric, but the drainage of the jugulo-digastric does go through the jugulo-omohyoid. So in conclusion, all of the lymphatics of the tongue do go through jugulo-omohyoid node. So this is a very important for tongue, especially in the case of spread of infection and carcinomas. So efferent that goes to the jugular lymphatic trunk on the right side, jugular lymphatic trunk that will drain to the right lymphatic group on the right side, and the thoracic duct on the left side. Supraclavicular nodes. These are not separate nodes. These are basically the part of the lower group of the deep cervical nodes. These are present into the. They are the one that go into the posterior triangle of the neck, and these are the ones that are draining the upper limb. Some and upper limb nodes are draining here, and this is the one that is near the accessory spinal accessory nerve that is damaged during its dissection, and they again drain into the jugular group of lymph nodes. These are supraclavicular nodes, and then we are left with termination. On the left side, jugular trunk goes to the thoracic duct. On the right side, it goes into the right lymphatic duct, and they may open independently also. So these are some of the pictures of natter that may help you revise the topic. So this is just a summary slide. I'm not going to talk about it right now. So we'll talk about the lymphatic drainage of each of the structures as we go through them. But this is again a placeholder and notes for you right now. Again, a summarizing slide talking about all of the structures that we have done till just now. You may take a screenshot for it, or simply open and read the books. Okay, this is one thing that I would like to discuss. These are the levels of cervical lymph nodes in dissections. These are the very important in surgery, especially when doing the mastectomies, when doing the surgeries for the breast cancers or other cancers. We talk about which level of lymph nodes are to be divided. So the level 1 will be the one that are present in the submental area, submandibular area. So basically supraphyte region, that is the first level. The second level will be the deep group. From the base of the skull to the carotid bifurcation, it will be the level 2. From the carotid bifurcation to the omohyoid intermediate tendon will be the level 3. From the omohyoid tendon to the root of the neck, the clavicle, will be the level 4. Posterior triangle of the neck will be included in level 5. Then we are left in midline, pretracheal and prelaryngeal, all of the one that is in the midline, that is level 6. And then the ones that are present right here in the superior mediastinum, that will be level 7. So these are group of superficial cervical lymph nodes. The levels will become important to you when you are talking about different surgeries. For example, in the mastectomies, neck dissection is done. In the classic neck dissection, done, so level 1 to 5 lymph nodes are taken out along with the structures that are surrounding them, that include the sternocleidomastoid, internal jugular vein, accessory nerve. However, to the taking out of these structures, sternocleidomastoid, internal jugular vein, and accessory nerve, they give some serious disabilities. So there is modified and radical neck dissection, that is functional neck dissection. So you try to save all or some of these structures as well as you can, so that the person may not have hampering of the functions due to it. Then the selective net dissection is dissection smaller than that will be selective net dissection. It will be defined accordingly of which nodes are you going to extract exactly. So this is all about the lymphatics. The last topic for today, the viscera, the thyroid gland and the parathyroid gland. Let's take a 1 minute, 2 minute break, and then we will move on to the thyroid gland and finish the lecture. Thyroid gland. Okay, where it is, what are its function, what does it do, what does it do, we'll be discussing physiology. Let's look at it. Thyroid gland. I will have to remove myself. Yes. Let's move to this view. Okay. So where is the thyroid gland? It is present in front of the neck, below the trachea, and it is hugging basically like this. It is hugging the trachea and larynx. It has two larger parts, the thyroid glands lobes, two lateral lobes, and the one part that is joining them in the midline. This is called the isthmus. You can see isthmus is in front of the trachea. You are able to see the first tracheal ring, the cricoid cartilage. So it is present below the in the trachea. Usually tracheal cartilage is number 3, 2, 3, and 4. It is present in front of it. Its weight is mentioned in the books, and it is extending. It is extending. Lobe is extending all the way up to the thyroid cartilage also. It can be seen overlapping the thyroid cartilage just above the inferior constrictor, and it goes below to the root of the neck and sometimes even into the anterior mediastinum. So this is what the thyroid gland, where it is present, what are its structures, and what is its extent, roughly 25 gram in weight, and it has three parts, the two lobes that we just discussed, the isthmus, and not always present, but there may be an extension from the left side of the midline going up towards the midline that is called the pyramidal lobe, and it is usually absent or very small as shown right here. A very small pyramidal lobe is shown right here. So this is what the thyroid gland. It's from the thyroxine hormone T3, T4. You have studied that in your endocrinology lectures, right? In yesterday, I think. And let's talk about its coverings. It is covered with the pretracheal fascia. It's a very common MCQ. It is covered in the pretracheal fascia, and pretracheal fascia it's attached to the tracheal rings and the larynx with the help of suspensory ligaments of Berry. Anteriorly, thyroid gland is related to the manubrium sterni. Anteriorly, thyroid gland is related to the manubrium sterni and the muscles between them. So the sternum, basically manubrium sterni becomes below the thyroid gland. So the strap muscles that are moving above, they passes over the thyroid gland to reach their original point. So the strap muscles are in front of it. Sternohyoid, sternothyroid glands are present in front of it. Medial to the thyroid gland are the structures it is hugging. Which structure it was hugging? The respiratory structures in front and digestive structures in the back. The respiratory structures include the larynx and trachea, and on the back of the larynx there was a pharynx, and on the back of the trachea there is a esophagus. And in addition to that, there are laryngeal veins. The ones coming from down are recurrent laryngeal nerves, and one coming from up are superior laryngeal nerves, and the part that is outside the larynx, the superior laryngeal nerve, that is called the external laryngeal nerves. And the medial relation can also include the muscles covering the pharynx and larynx. That includes the inferior constrictor of for the pharynx, cricothyroid for the larynx. So these are the structures that are related to the medial aspect of the thyroid gland. And posteriorly, you can see that this is running common carotid artery, this is running internal jugular vein. So posteriorly, thyroid gland is related to the carotid sheath and all its contents that we just discussed. The deep cervical group of nodes, common carotid artery, internal jugular vein, vagus nerve, and deep cervical nodes. So this is about thyroid, and thyroid gland is supplied by, to show the picture, it is supplied with a set of arteries: thyroid superior, inferior, and thyroid artery. To show you the superior thyroid artery, I will move to the slide behind. So this is the superior thyroid artery, the first branch when counting from downwards from the external carotid artery that comes down and it supplies the thyroid gland. We discussed all of it, the branches in the arterial section. We talked about the infrahyoid branch, the branch going to the internal branch, the external branch going to the thyroid gland, and it is further dividing into the anterior division and the posterior division going to the back. And this is the superior thyroid artery. The thing that has to be remembered here is that the relation with the nerve. You can see just behind the artery there is external branch of superior laryngeal nerve. So this is the very important relation to be remembered right here. So this is the artery that nerve that is near the artery, superior laryngeal nerve. And during thyroidectomies, you have to ligate this artery. So it happens, if the surgeon is not careful, that the superior laryngeal nerve get tied up in the knot, get ligated along with the artery also. So you have to remember very carefully the relation of the nerve with this artery. And then there is posterior inferior thyroid artery. It is a branch of thyrocervical trunk we discussed in detail, and it is coming thyrocervical trunk. It is the upper branch, and this moves medially in an arc behind the carotid sheath, and it goes to the inferior pole of the thyroid gland. And then we are left with thyroid artery. It is not shown in these pictures, but sometimes it originates from the brachiocephalic trunk. Right here it goes up, and sometimes it originates from the directly from the arch of aorta, and from the arch of aorta it moves up and it supplies the thyroid gland in the midline. It is a very rare artery that is not usually always present, but this is one of the arteries. Veins, we have superior, middle, and inferior thyroid veins. Again, these are more visible in this picture. Superior and middle thyroid veins. Superior thyroid vein, it goes to the internal jugular vein. It may go into the facial or lingual vein also, but it usually goes into the internal jugular vein. The middle thyroid vein, it does go into the internal jugular vein by passing, and both of these, while going to the internal jugular vein, they are crossing in front of the carotid artery, common carotid artery. And the inferior thyroid vein, it is going down to the brachiocephalic veins. So there is a paired internal thoracic inferior thyroid veins, and the inferior thyroid veins are different from the thyroid artery in the way that thyroid artery is very rare artery, it's single, it's not always present, but here they are very constant and both are going into a very constantly into the brachiocephalic vein. So this is about the thyroid gland, and the lymphatics, they simply go to the deep cervical nodes. Then we are left with the last topic, that is parathyroid gland. They are four in number, both on the posterior aspect pairs. The thyroid parathyroid glands are present. Superior parathyroid gland are present near the middle of the thyroid gland, and the lower ones are near the lower pole. The upper one are originating from the third pharyngeal arch, and they are very constant in position. They are usually at the level of first tracheal ring, and they usually present within the pretracheal fascia embedded in the thyroid gland. But the inferior ones, they have to, sorry, superior parathyroid were from fourth pharyngeal pouch, and the inferior parathyroid gland, they're from the third pharyngeal pouch. Embryologically speaking, they have migrated a long way, and due to this long migration, they have a very variable pathway, very variable location, both on the depending on the height and embedding in the fascia. It is present at the lower pole of the thyroid gland, and sometimes above it, sometimes below in the mediastinum, and it may be present outside the fascia, inside the fascia, and even within the gland also. And it's all the lymphatics and arterial and nervous supplies is similar to the lower part of the thyroid gland, that is the inferior thyroid gland and deep group of cervical lymph nodes. Thank you so much for listening. Please forgive any latency on my part and any mistakes if I have made, and do mention those in the comment section. If you have any further queries, suggestions, feedback, please do mention in the comments below. Inshallah, we will meet you tomorrow with the next lecture of face, scalp, and the spaces around that region. See you then, inshallah. Allah Hafiz.